got to start working on my mobility, man. I got to start doing some more strength and
some shoulder work.
Some shoulder.
Yeah. Okay.
Who's this?
I don't know. Can you do that?
No.
There you go. That's your shoulder workout right there, bro.
He's yoked out, bro.
Hey, look at those abs. Woo!
All right, you're all good. That's good. Good job, bro. What's up, everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is the Professor John Penacerrata, and we have a special guest here today. We got a gymnast. What's your name? Go ahead, introduce yourself.
My name's Forrest.
Forrest.
Cool
Welcome,
name.
Forrest.
Cool name. I love
He's
it.
a gymnast out of the peninsula out here in the Bay Area. And one of the things that we get a lot of is our questions. And we get a lot of parents that come through the door and they ask us, hey, I want you to assess my child. I want to make sure that you guys can treat him or make sure that he gets better at his sport or his whatever athletic ability that you guys want from him. But one of the things that we do in the office is we want to check, we do assessments, we want to check for range of motion, but when it comes to treatment, when is it okay for us to treat a kid in the right way, right?
Yeah.
When it comes to chiropractic care, there's so many different chiropractors out there, there's different types of chiropractors out there. The way we utilize chiropractic care is for pain modulation and working to increase or access movement. And in his case, what you guys saw in the very beginning of this video was you saw some of his movements. You saw his assessment. You saw him being able to touch his toes. He has pretty good movement, and most kids do. Actually, not all kids your age are that good at that movement. You know that, right?
Really good right there.
Yeah, so as a gymnast, he's trained in those movements. He can handstand, you can walk. What do you do? What do you do? Can we show them some of those videos that you do?
Can I do a backflip?
Oh! Dr. Joe, ready?
All right, here we go. Let me try this. This is how you're supposed to do it, right? No, I'm gonna eat it so bad. I even got scared thinking about it.
My hands got sweaty.
All right.
Good job, man.
Good job, man. That's awesome. So again, one of the things that a lot of that we see is when is it okay for kids to be treated with chiropractic care? And in his case, you can see he's an elite athlete already. He does handstands. You do push-ups on rings, right?
Muscle ups.
Muscle ups. What else do you do over there? You do backflips, obviously.
Yeah.
Oh, you can do it on a horse?
Yeah.
Oh, that's
How old are you,
so
Forrest?
cool.
9.
You're 9. You know, it's funny. There are a lot of 9-year-olds that don't have this movement.
Yeah.
They don't have that neck movement. They don't have the ability to touch his toes. Now, remind you, he's very functional with being a gymnast. He's able to do a lot of exercise. He's doing calisthenics. He's not necessarily lifting weights. And he doesn't necessarily need to with the type of sport that he's working with. When we do assessments, we're trying to figure out what's his dysfunctional pattern that's keeping him from being so efficient in his movement. Now with sport, especially in a sport that is so functional like his, we got to make sure that they're just being efficient with their movement rather than so restrictive with their movement. And those are the things that we look for. And in his case, he's looking pretty good.
Oh, really?
What we do when we work with athletes that are of his caliber is we want to make sure that we're working with recovery more than anything else.
Yeah.
We want to make sure that his muscles are constantly being massaged out. We want to make sure that we work, even at his age, as if he's going way too hard, his body is going to be in a recovery mode, and we need to make sure that we allow for his body to recover the proper way rather than starting to stiffen up as he gets older, right?
Right.
Yeah.
You want to continue to keep moving for the rest of your life, right?
Yeah.
You want to do this for the rest of your life? You want to retire with this?
That's so cool. You know, having friends that have children his age and even younger, sometimes there's actually the parents are the ones that, on the flip side, restricts movement, right?
Yeah.
So shout out to your dad, your folks to allow you to do this sport because now you're really efficient at being functional and moving properly.
Yeah.
And you want to continue that as you get older.
Yeah.
Right? Because you don't want to be like Dr. Joe. He's really stiff.
Yeah, I can't do those backflips.
I can't do it either.
So one of the things about Forrest that we just learned is that he works out how many hours a week?
13.
He works out 13 hours a week. And if you think about it, most people, most people get
Barely two.
maybe 2 to 3 hours a week in their workouts, but this kid is working for 13 hours. And if you can imagine the amount of stress that this kid puts his body through, he does need some recovery, right? And here's some 3 tips that you guys can utilize that can help you recover a lot faster, right?
Yeah.
And he needs it. Number 1, massage. Make sure that you guys check with your local massage therapist. In his case, I would recommend a neuromuscular therapist, right? A neuromuscular therapist can help out with in making sure that he doesn't have those movement restrictions. Check with your chiropractor as well. If he does have restrictions, if it's a joint restriction, maybe a chiropractor can help out with that. But I highly recommend checking with a neuromuscular therapist or a massage therapist, a fancy massage therapist that can help him recover a lot faster and a lot smoother. We want to continue to keep blood flow in there. We want to get those muscles to relax. We want to make sure that those muscles recover the way they're supposed to. Step number 2 is check out your a percussion therapy gun. Over here, we utilize the Hypervolt by Hyperice, and this is just a simple percussion therapy gun that can allow for the muscles to move. It's kind of like a nice little massage, percussion massage, and it allows to increase fluidity between the muscle and the fascia. And in this case, notice I'm just putting it on his shoulder here, but as a gymnast, he needs to continue his movement, right? So I don't just leave it on one spot. He's gonna go ahead and bring his arm across your body here. That feels pretty good, huh?
Yeah.
Are you gonna fall asleep right now?
No.
No?
I am.
Yeah, I'm falling asleep just doing it for you. And you want to get all around those muscles that are highly utilized. And in his case, his shoulder complex. We want to make sure that his shoulders stay resilient and strong as he's going through different ranges of motion. Now notice what I'm doing here. I'm putting it in front of his chest. I'm going to put it in front of his bicep. Go on to his tricep here. Go ahead and bend your elbow here. Bend your elbow and then bring your arm across you here. And again, we're just trying to do different things to allow for fluidity between the muscle and the fascia.
So how much time do you think in each area you would spend the Hypervolt?
Oh, I would be going, again, if you guys have it at home, why not go for a good amount of time? Maybe like 10 to 15 minutes of it.
Per
right?
side, per body part?
Oh, no. Per body part, you're looking at about maybe a couple minutes, you know. As long as you would like to be on there. Of course, I wouldn't be saying like, hey, stay in one area for an hour or so. But anywhere between 5 to 10 minutes or so. Okay. You can even do it a little bit less if you need to. You don't need a ton of work, a ton of time. But again, if it feels good, keep going for it. Cool. Why not, right? The last tip that I have is look up a person that can help with myofascial decompression, cup therapies. Now, cup therapies are being shown, and there's a lot more research that's coming out there now. Cup therapy has been showing to allow for, again, that fluidity between the muscle and the fascia. So if you have a therapist that can apply cupping therapies for you, we can utilize those to help increase movement, maintain movement, and allow for a speedier recovery for any injuries that you might be dealing with, as well as maintaining a good amount of control over those muscles, right? Because instead of what we were doing with him was where a percussion therapy, instead of a compression therapy, we're working on a decompression therapy. We're pulling the muscle and fascia off of each other to allow for blood flow into those muscles, to allow for a little bit better control of those muscles, and again, connecting with the nervous system in that way to allow for him to recover faster. Thanks for joining us on another episode of the Move Better channel, you guys. Thanks again to our co-host, Forrest, for coming on today and showing us a few of his tricks.
He's badass.
Like, comment, share, send this out to some of your family members and friends that have some questions or concerns about getting their kids in a better position for their sport. See you guys next time.
All right, handstands.